Family therapy as a psychological treatment of schizophrenia. So you need to be aware of family therapy, CBT, and token economy as a way of managing schizophrenia. So this video is going to solely look at family therapy as a psychological treatment of schizophrenia. Now, family therapy is going to focus on families because they are believed to play an important role in the development of schizophrenia. So in particular, when we looked at the psychological explanation and family dysfunction, there might be schizophrenic mothers, double-blind theory, and expressed emotion as explanations of communication patterns that results in families developing schizophrenia. Now, the therapy aims to improve the interaction and communication that happens within that family, as research suggests that that can contribute to relapse rates. So when we talked about IE and patients going back to high EE families, they were 4 times more likely to relapse than if a patient was to go back to a low EE family. So if families are talking about a schizophrenic person in overly critical and hostile ways, they are more likely to relapse. So the therapy is going to try to reduce the level of expressed emotion and improve communication and interaction within the family. Now, it's believed to help in many ways. Now, Farrow identified different strategies that could help reduce that level of expressed emotion and improve communication style. So they will try to have less stress in regards to caring for the relative with schizophrenia, reduce any anger and guilt in the family members. So they will be encouraged to talk about their family and what they find helpful and what makes things worse. Family members are still trying to have time for themselves, so that encourages them to listen to each other and openly discuss any problems. And equally, they're going to try and challenge and change negative beliefs about schizophrenia. So it helps families to support the schizophrenic and resolve any problems. So they might help them by learning different things about schizophrenia and what actually schizophrenia is all about. Now, typically therapy lasts between 3 to 12 months and generally happens over at least 10 sessions. Now, typically it happens alongside the use of antipsychotic medication. So the individual is going to be taking a combination of antipsychotic medication and going through family therapy as well. In terms of supporting evidence then, or some evaluation points, there is research support for the strength and effectiveness of family therapy. So a review of several studies, so a meta-analysis, concluded that there was lower rates of relapse within a year amongst those who had received family therapy as opposed to those that hadn't, which indicates that family therapy helped to reduce the symptoms of schizophrenia and was successful in treating the disorder. That helps strengthen the effectiveness of treatment, especially the reduced relapse rates means that there are economic benefits for family therapy. So it helps to improve the economy as well. Also, there's advantages of the treatment as there are long-term benefits surrounding family therapies. The patient is supported whilst outside of the institution, and family members gain skills in supporting the schizophrenic person. The individual can be supported even when treatment has come to the end, as the skills can be used by family members successfully. This is a strength because, unlike drug treatment, family therapy has long-term effects and benefits on reducing the relapse of schizophrenia, whereas drug medication seems to be a short-term benefit. However, there are issues surrounding methodological problems in research studies. So for instance, Farrow's meta-analysis failed to allocate patients randomly to the different treatment conditions. Equally, it was found that 20% of studies failed to use blind methods such as single blind or double blind, so observers were unaware of what condition patients were in. This means it reduces the validity of conclusions drawn about the effectiveness of drug treatments. So in terms of that meta-analysis, you could either have Farrow's review of studies and this methodological problem as 2 evaluation points, Or you could combine it as that counter argument to show the examiner that you're aware that yes, there's supporting evidence, but there are issues with research. There's that subtle grey area that we shouldn't always take supporting evidence on face value. We should look at the method used and whether it's an effective method and whether the results drawn are useful and do support the theory or not. Equally, family therapy does require family members to be willing to engage with the therapist and to engage in the therapy. Furthermore, they might not be available all the time or willing to take part in the therapy. So this might demonstrate that it isn't an appropriate form of psychological treatment for schizophrenia, and maybe CBT or drug treatment might be a better way of treating an individual if family members aren't willing to take part in the therapy. So in terms of 16 markers, outline and evaluate psychological treatments of schizophrenia. So with family therapy, I would do one AA1 paragraph on family therapy and evaluate it, then do another AA1 paragraph on CBT and evaluate it. I would suggest that you do that because the word treatment is plural, so it says treatments. So that suggests that you have to do more than one psychological treatment, so you have to include CBT alongside family therapy and not just talk about family therapy for 16 marks. Equally, you could get a 16 marker just solely on family therapy, so make sure you have enough notes on to talk about family therapy across 2 AA1 paragraphs and focus on which 3 evaluation points you would use to talk about the strengths and weaknesses of whether this is an appropriate treatment and an effective treatment of schizophrenia.